Hello and welcome to our new topic. Today's topic is about a major global health issue that is one of the largest contributors to the global burden of non-communicable diseases. Yes, diabetes mellitus is a global disease and covers a variety of conditions under its umbrella, and in this lecture series we would learn about various drugs to control it. Remember, diabetes can be either prevented or controlled but not cured. Let's start. The learning objectives are shown. Please take a look. This slide depicts the global burden of diabetes mellitus. No area with human habitation is spared. Almost 10% of world population is affected, which means that it is hundreds of millions of people already affected, and many more undiagnosed. Diabetes mellitus is caused by an absolute or relative deficiency in circulating insulin hormone level. Insulin is secreted by beta cells of the islet of Langerhans in the pancreas. This slide shows the precursor molecule of insulin with C-peptide still attached. Insulin is released from pancreatic beta cells at a low basal rate and at a much higher stimulated rate in response to a variety of stimuli, especially glucose. Other stimulants such as other sugars, e.g., mannose, amino acids, especially gluconeogenic amino acids, e.g., leucine, arginine, hormones such as glucagon like polypeptide 1, GLP-1, glucose-dependent insulinotropic polypeptide, GIP, glucagon, cholecystokinin, high concentrations of fatty acids, and beta-adrenergic sympathetic activity are recognized. Insulin promotes the storage of fat as well as glucose, both sources of energy, within specialized target cells and influences cell growth and the metabolic functions of a wide variety of tissues. Main peripheral targets organs are liver, skeletal muscle and adipose tissue. Thus, the normal function of insulin is to reduce blood glucose after a rise due to a stimulus or meal intake. This is achieved by simultaneously doing several processes, such as stimulating glycogenesis, inhibiting gluconeogenesis, enhancing peripheral glucose uptake, and regulating fat-protein metabolism. Take a look to compare what happens to plasma glucose level normally and in diabetes. An oral glucose tolerance test is a widely used test to indirectly check the insulin-mediated response after ingestion of a fixed dose of glucose. This slide shows various glucose transporters which are responsible for glucose uptake. Note the importance of GLUT4. This slide shows how, during fasting, when blood glucose is low, ADP to ATP ratio favors potassium efflux and maintains the potential difference across the cell membrane in pancreatic beta cells, preventing a sudden release of insulin in the absence of stimulation. One mechanism of stimulated insulin release is shown. As shown in the figure, hyperglycemia results in increased intracellular ATP levels, which close ATP-dependent potassium channels. Decreased outward potassium efflux results in depolarization of the beta cell and opening of voltage-gated calcium channels. The resulting increased intracellular calcium triggers secretion of the hormone. The diabetes can be classified into 4 categories or groups as shown. So, one should diagnose the underlying pathophysiology for a better treatment. Thanks for watching. Don't forget to like, subscribe, and share. Happy learning!